coming from the perspective as a professional who has helped to provide that training to medical staff, and as a person who has lived with lupus since 2012, and later with fibromyalgia, and then later with chronic migraines, because you just can't have one chronic illness. 23.2% of patients did have diagnostic errors. 5% of records had stigmatizing language. Stigmatizing language was more common if the patient was African American, if they had unstable housing, if they also used public insurance, so Medi-Cal, Medicare, those sorts of things. What can you do? Number one, and I want you guys to write this down, is to check your charts. Check your medical records and see if there is any sort of stigmatizing language that is present. You can be your own best advocate. Make sure that you have a support system. Speak up for yourself. This can be very scary, especially if that stress system is happening in your brain. So sometimes you just have to pause. Excuse me just 1 second. And let them see you take a deep breath, okay? Because there's something called neuroception, where what one person is experiencing internally, the other person will experience as well. And so if they see you taking a deep breath, their mirror neurons in the brain will have them take their own deep breath. Both of you all are now more calm, and you can